Welcome to the Hybrid Fitness Podcast, where we talk open and honest about all things health, fitness and business, with your hosts, PJ Black and Michael Lennon.
Junior is her name, by the way.
How's it going, guys? So PJ from Hybrid Fitness and Elite Fitness Performance Academy, and today I have no John with me, so usually I take a podcast with my partner. He's away to San Diego for the Fitness Business Summit. And on the call today, we have Dr. Fionnuala McHale, and I'm just going to let her introduce herself. So tell us a bit about yourself, Doc.
Hi guys, my name is Fionnuala. So I'm a medical doctor, and I have my sidekick Junior here with me as well. So I'm a medical doctor, and I guess I specialize in functional medicine. I suppose I got into it a number of years ago, quite a while I was in medical school. Through my own health issues, really, I sort of had no choice but to look elsewhere when I wasn't getting the help that I needed from that side of things. I suppose relevant to today, I also have competed in powerlifting. My background is competitive swimming as a child, I suppose. Got into weight training and then, realized I was relatively strong. So got into the, obviously competitive nature comes back in and did powerlifting. I've also done some bodybuilding shows, well, just one, I would suppose. And then I suppose I went on to do kind of mixed competitions, so fitness with, I suppose the conditioning side of things but with physique. So the IFC was a great competition. But I suppose now at the moment I work with a lot of health issues. Sorry, the dog.
Okay.
A lot of, I suppose, more chronic disease patients, but also athletic level clients. I did a lot of work with people around weight cuts for powerlifting, weight cuts, I suppose, combat sports, MMA, and things like that. And the IV side of things as well. So using those, as complementary with the functional medicine side of things, specific to testing, but also in the sports field, bodybuilding, especially in prep week, and for other sports too, enhancing performance, enhancing recovery, and mood, I suppose, as well. Lately, I suppose I've got into more the psychiatry side of things, again through my own experiences of my own health issues in that area, but also it's been a passion of mine for years. As a kid, I was always into the neuro side of things, and the use of holistic practice in terms of getting people better, because I really do feel it's a big gap in psychiatry and being able to get people well, I guess. It's failing a lot of patients from what I see, myself being one of them.
That's like we were just talking off there about bridging that gap. The example sometimes we use is if you are a dermatologist, you don't step on an endocrinologist into their field, and they don't step in your toes, and it's what I was saying to you earlier was
disconnected, I suppose.
Yeah, and it's almost like that's not my job. Whereas like based on my learning over the last few years, like I could have stayed in the realm of just being a personal trainer, but I wanted to improve my nutrition. I wanted to help people. That led me into functional medicine, and then into, sports massage and rehab. And it was just to make me a better coach. Also, as you say, trying to bridge the gap between, because if someone doesn't push those boundaries, then everyone's sort of just left in the box. And it's, I found that very, very refreshing and stuff from yourself. The fact that you put yourself out there.
Yeah, and I suppose I've been honest with my experiences as well. Is the dog interfering with the sound?
No, don't worry. Well,
can you hear me over?
Yeah, I can still hear you.
Okay, great. She'll quieten down a bit. Junior, sorry.
Okay.
She's not used to having another man around the house. Hold on one second. I'll get her with it.
Bring her to Belfast next time.
I will. Oh, we'll leave her. Hold on. I want to actually just get her some food. Sorry, do you mind?
I'll pause this.
I'll just get her something to occupy her. Okay, sorry.
So you're saying there, Fionnuala? Go ahead.
Yeah, so I suppose we were talking about bridging that gap between the conventional side of things and the using, I suppose, the alternative methods. And I suppose that's where people get confused as well. Functional medicine or complementary medicine is probably a more appropriate term, because it's not, I don't obviously, it's not like there's any problems with conventional medicine. It has its role. It certainly has its role in acute cases. But I suppose, as we said, it's failing a lot of people, because we're not really, looking at just one specialty, like you were saying earlier, just dermatology, just gastroenterology, just endocrinology, doesn't really give us, I suppose, it doesn't allow us to see the body as a whole, as I suppose, in terms of the biochemistry and the molecular side of things, but equally, I suppose, in terms of the person that's sitting in front of you, you're not looking at, I suppose, what's the underlying cause of the disease. It tends to have the approach whereby, let's say, we're just bandaging over a wound. Like I had a client earlier, skin issues, very, very chronic skin issues, and they always come in, and that's they present with is usually one issue. She's been to all the dermatologists and all the rest, but I suppose you dig deeper and there's a whole pile of things underneath. You look at gut function, low grade inflammation that's been there for years, and also you're looking at the psychiatry element of it as well. The same lady would have the issues around dopamine metabolism genetically, from what I see. But I suppose that the goal of functional medicine or complementary medicine is to integrate both conventional side of things. So you may need to stabilize someone on medication, but also while doing so, you're kind of looking at how did this happen? These things don't just come out of the blue. I suppose in that client that I was referring to, issues as a child, very aggressive as a child, probably a response to some abuse that was ongoing in the family. And I suppose you see the research where it shows there is this hyperarousal of the HPA axis, which doesn't manifest even until puberty in terms of the hippocampus and things in development there. And the long-term consequences of that, so the patient then becomes more susceptible to issues of cortisol metabolism later in life, which can interfere with the inflammatory side of things. So
you're obviously saying that could be stemming from that sort of psychological trauma they maybe experience in a younger age.
Yeah, and I suppose that's something I've done a lot of research into recently, I suppose based on my own experiences. It's fascinating to see, and it's something that myself personally would have neglected to ever deal with. I would be the type of person that say, okay, something bad happens, it's in the past, leave it as it is, there's no need to bring it up. But inevitably, the brain is a fascinating organism, and I've been privy to experiencing that, how fascinating it truly is through my own experience, the ability to repress memories, and then the ability for them to catch up with you as you go on, and for them to have such a massive impact on your health. So again, that's why functional medicine is fantastic, because you're really looking at all aspects. You're looking at nutrition, you're looking at supplement nutrition deficiencies.
Hello? Might have just paused there, guys. Bear with us a sec. Can you hear us, Doc?
Because you do need to look at their past history, their ability to cope with stress and things like that. Sorry, now she's barking at me again.
Bring her up.
Where is she? Come here. Stay low. Come on, stay low. Come on. Woo!
This is the real person that I wanted on the podcast.
And this is another example, I suppose, of functional medicine. So, you're not just looking at, let's say, very, things that we would classically associate with health, health and exercise and, the psychology, but, other treatment interventions, animal-assisted therapy, connection to nature. They sound like fluffy things, but actually, if you look at the research, you'll see huge benefit to it. And I, again, myself found great benefit from having my psychic here, and that's, and that, I suppose, being good at functional medicine too, or, being a good functional medicine practitioner as such, is about knowing all of those other things that you can incorporate into people's lives to make their life better. It's not just taking a medication. It's not just taking a supplement. That's you see, that's the other thing, I suppose, where people tend to get confused as well. It's if you just relying on, I'll take this supplement or I'll take that supplement, then you're really doing the same thing as conventional medicine. You're just really, you're still popping a pill behavior. You have to look at other things, and behavior being a big one. Like, for example, the addict. They can get drug out of the system, but unless they change the behaviors, then they're not going to have long-term success, and they're not going to be able to prevent relapse. You know, it will catch up with them eventually.
On those types of people with addictions, do you see obviously inhibited maybe dopamine responses and serotonin responses with those guys?
Addiction?
Yeah.
Well, I suppose addiction is a very neurochemical disease, you know, like there's, I mean, I can see from patients, I have plenty of experience with the disease itself, but in terms of family and things like that, but I suppose the genetic component is always there, and the genetics tends to lie in the dopaminergic metabolism. Again, you find bits and pieces in research. I think there's probably a lot more that needs to be done, but certainly genetic component, but also exposures. And I suppose that's where with addiction you're kind of looking at it, you know, is the genetic link exposures, like say for example the parent is an alcoholic, well then you look at the environment that the child is going to grow up if the parent is an alcoholic. So you know they will be exposed to abuse, about, you know, I mean it may not be physical or sexual abuse, but I suppose abuse even from a verbal perspective or an environmental perspective. You know, it's not the nurturing, caring environment that you would ideally like to have as a child, but then you know that child is more likely to go on to be susceptible to addiction by virtue of the child's exposures, aside from even having a polymorphism like the calcium-transferase gene. You know, no, because even if you look at studies like, you know, there's two things that happens to the child of an addict. You know, either A, they try to avoid substances because they're aware of the risk, or B, they end up doing the same thing that the parents did, and using, you know, substances as a form of self-medication.
Yeah, awesome.
You know?
So I just want to go into obviously the effects on the likes of gut permeability and obviously microbiome in terms of, you know, health. You know, maybe it's I'll not say cure, but treatment of, you know, maybe anxiety, depression, responses that you're noticing. So like what?
Well, go ahead.
I was just going to say, what's your thoughts on that? You know, like for me, I'm massive into gut health. Like for me, you can probably put me straight, but that's usually my first go-to, because at the end of the day, from whether it's a nutrition background or a massage or rehab background, it's okay. We may be treating this what's the cause, because a lot of the time it is referred pain, as you say. You know, someone's displaying those symptoms with their skin, but what's going on behind the scenes and what's possibly causing those. So, you know, I just love your intake on that.
Yeah, well, I suppose like the end result being anxiety, depression, of I suppose a whole host of dysfunctions that goes on underneath, and it's never really one thing. You know, it's usually a combination of factors, in my experience, anyways. Gut being a big one, and again, gut inflammation, but also I suppose HPA arousal too. So it's, you know, it's hard to figure out, like from the research that's out at the moment, which comes first. But I suppose from dealing with actual patients, you know, like it's all well and good looking at research, but experience with people and you know, their experiences and seeing trends in people is always super relevant. So I guess the gut side of things becomes relevant because I suppose when you look at the literature, you know, I was just reading it yesterday, so at least it's fresh in my head since you asked the question. But you're looking at imbalances, you know, even things like cesarean section versus vaginal delivery. You know, obviously, ideally, we get the organisms from the vagina as we pass through the birth canal at birth. If someone is born by C-section, obviously they're going to have less. They're not getting that passage of microorganisms
I read
at birth.
I can't remember who wrote it. The GAPS book, Gut and Psychology Syndrome. Have you read it?
Okay, yeah, absolutely.
They were saying the fact that I think they actually mentioned babies born in Mexico are more likely to be born by cesarean, and obviously our first sort of contact with bacteria is obviously in the vaginal passages and stuff as well. So I just found that really interesting. But
yeah, and actually, from what I was reading yesterday, you know, the even in the placenta, you know, like there's all of those things. So the health of the mother becomes relevant too, and then breastfeeding obviously is, you know, another way of feeding in the organisms and boosting the immune system for the child. But so there's that element of things, you know, with the organisms. Similarly, like I suppose the other thing you want to bear in mind is stress hormones and things like that, and how that impacts the gut flora. You know, so say for example that, like, you know, like I referred to the example of the child who's exposed to, let's say, unfavorable environment as a child, you know, they end up with HPA arousal, which kind of continues with them through life, you know, an anxious disposition. And that being said, you know, we tend to see that as always a negative characteristic, or let's say something negative, like, oh God, this is wrong with me because X, Y, or Z. But also, you know, those tend to be the same people that like achieve great things because they are permanently on constant alert, which is what HPA or hyperarousal is. You know, they're constantly aware of things, they're constantly thinking 2 steps ahead, and they tend to do quite well, you know, in terms of, you know, studying, in terms of work, in terms of success, you know, in terms of building a business, tend to be more likely to be self-employed as well. And I suppose from that side of things, it's great, let's say, from you know, functioning in today's world, because it's a driven world. We have to be kind of proactive and all of that. But I suppose the underlying consequences physiologically become problematic, I suppose, and they generally don't manifest until later in life. And there's a lot of research, I suppose, elevated cortisol, gut microbiome dysfunction. So then I suppose there's people are more susceptible to microbial imbalance, you know, use of antibiotics, things like that.
Yeah.
As a child, you know, back, I suppose, when I was growing up anyway, there wasn't much awareness of antibiotics. And I suppose now we do have a greater awareness. And equally, I suppose, when you're looking at, you know, the food side of things, like herbicides, pesticides, the quality of the soil becomes relevant. So all those things lead us to, I suppose, a society whereby the flora is not as diverse as it ought to be. You know, like that's it, as diverse as when we, a number of years ago, when we didn't have all of these chemical manipulations of foods, GMO, things like that. And then once you have any sort of, I suppose, damage to the lining, you know, whether, let's say you have a chronic disease as such, and there's a huge amount of inflammatory cytokines floating around in the blood, that will obviously have an issue in terms of permeability. So, you know, like, I suppose, I don't know who's listening, but permeability, really, you're looking at like how substances are transported across the gut barrier. And I suppose I always like to explain it kind of in simpler terms, because, you know, it's kind of like, from my perspective, obviously, physiology and science is something I grew up with. But for other people, it can be difficult to get the concept. And I suppose to explain it in the sense of being basically like a hollow tube that goes from one end to the other, you know, ending in the toilet. And you know, we have to look at the food coming from our plate. So let's say it's a steak, rice, asparagus. How it gets from that to the tiny little molecules that float around in our blood and give us benefit. There's a whole host of processes that go on, you know, between acid secretion, enzymes, and obviously the effect on the microflora. But if I suppose when we're looking at the food composition too, that's going to have an impact on the microbial balance. You know, the research I was looking at yesterday, anyways, was on you know, high fat, high fructose diets, low fiber diets, obviously, and synthetic foods. But I suppose again, to go back again, sorry, I'm jumping over and back a little bit. But if we have any, you know, if there's chronic disease, like I said, the inflammatory cytokines. We were talking about intestinal permeability. Sorry. So the permeability issue, I suppose, I was saying there's a hollow tube, goes from one end to the other, and the food goes in, it goes from the meal on the plate in through the tube, and it has to be digested, absorbed. And that permeability refers to whether, you know, whether those sensors on the lining of the gut are working well to allow the good stuff to come in, vitamins, minerals, and to keep the bad stuff out. When we have too many, I suppose, if there's any damage to that signal, those signals on the lining of the gut, i.e. from, let's say, chronic disease and inflammatory loads like obesity, diabetes, for example, those gaps start to change, and you're more likely, I suppose, to allow what's called endotoxin in is one thing. So again, that's just a little protein on the surface of gram-negative bacteria, and that gets into the blood, and again, it's lipopolysaccharide that causes endotoxemia, and again, then that perpetuates a whole cycle of further inflammation. So again, it's a vicious cycle once you get into it. And I suppose I always, because I just came from seeing patients, so I'm in the right mind frame at the moment as well. People tend to get very caught up and, you know, disheartened by, you know, the all of the science that's there. You know, I mean, even things I talk about, there's probably so much that you could write down and say, I should do this, I should do that, I should do X, Y, and Z. But to bring it down to simpler terms, you know, it's often reassuring, because actually when we look at the gut, there's so much that we can do gut-wise, you know, exogenously, let's say, you know, through changing diet, you know, through, I suppose, avoiding certain things that are going to cause us problems, and we have good access to those things now. suppose, with the explosion in the research in the health field. But I suppose keeping it down to being able to make simple dietary interventions, like even I suppose if you look at changes in food, macronutrient composition, and caloric load in particular, you can make great changes in the microbial diversity even in 2 weeks. I think in the rat studies it was in 1 day, but in humans they said 2 weeks, or over the course of months. Which is why I suppose when you use elimination diet for people, it tends to give them results fairly quickly.
Yeah.
Some people may need longer than others, I guess. And ultimately it depends on, obviously I would do mainly a lot of stool testing and things like that. You identify what organisms are there. It's reassuring, like I said, to patients, because you can see what's there. You know what you need to do to reset the balance effectively. If there's a fungal growth, you might need to take X, Y, or Z herbs or let's say pharmaceuticals in some instances. And that's where I suppose it comes back to, again, integrating conventional practices, because for parasites especially in particular, to be honest, the herbal formulas, in my experience anyways, if anyone's listening, they might have had better experience on this. If you do, please let me know. But you generally do need a combination of pharmaceuticals to really get good eradication. Things like blastocystis, dianthomeba, they're very difficult to eradicate for people, and unfortunately in Ireland they don't get access to medication. So there's a centre for diseases, digestive diseases in Australia, that actually does a lot of work even with, let's say, transcolonic infusion of antimicrobials, specifically for coexisting blastocystis and dianthomeba. So like I said, it's reassuring for people to, and the improvements that people will see clinically from resetting the balance, regardless of what the research says. I've seen it in clinical practice for years. The research wasn't really out back then. So I would just see this happening. Okay, the person is saying they have more energy. Okay, the person is saying they have less anxiety. The wage is coming off a lot faster. The role of microbiome in the metabolism. So I was just, all I was effectively doing was seeing the results of the tests and getting rid of whatever wasn't supposed to be there and putting in what they needed. Really. And the mood impact was striking. There's only two things really that I would have seen clinically very, like you try X, Y, or Z supplement or whatever, you tend not to see as dramatic improvements. But for anxiety, depression, and rectifying let's say the microbial diversity, a massive clinical impact, and actually IV therapies as well. Magnesium for anxiety seems to work exceptionally well.
Yeah.
And glutathione actually too, because you're balancing off the immune load that we tend to associate with as been seen in the research for depression.
Yeah. Based on what you're saying, Fionnuala, there was something. The reason why I wanted to bring that up was because obviously I'm from Belfast, and the north of Ireland has probably the highest suicide rate in the UK, and obviously, do you believe, and again, that's where we're talking about that gut-brain axis, that impact that it has. Do you usually see an impaired, you probably do, but I'm just going to ask you anyway, but do you see a natural imbalance in gut microbiome, gut permeability, inflammation, and people who have, depression, who are taking antidepressants? Do you notice that these symptoms are correlating? And
absolutely. So like what you'll see, I suppose, if you're, like I was reading there yesterday on how some of the interleukins can affect tryptophan availability and things like that. And I suppose like the changes that you see in the neurotransmitters in the gut, they don't really permeate. They go to the blood, go through the blood-brain barrier, but you will see, I suppose, alterations in availability of precursors and things like that, and the impact of mood. I suppose I have a few clients that, suicidal ideation is obviously, severe case, and you're not going to get someone not thinking about suicide by working on the gut. It takes too long anyways, and that's a very acute situation for someone. Suicide is, I think, I was reading some epidemiology the other day on, I suppose the impact of it. Depression was the third leading cause of deaths in the US. And suicidal ideation is a big one because it often goes unnoticed. So I suppose to go back to the point was I was saying was, they often will need to be stabilized with medication. Not often, they nearly always will be needed to stabilize with medication. And again, it comes into back to the same thing. Functional medicine is not alternative; it's complementary, using both the tools of both aspects. But then also, I suppose, and that's why in psychiatry, I feel it's an area that I really want to get into more, because it's one area that can really benefit from the complementary approach. Because let's say you do stabilize a patient on the medication. Let's say you do get them not thinking about suicide, the ideation goes down and the mood starts to lift, which never happens overnight, unfortunately. You could be working on things that maybe have caused this in the first place. So let's say if there is, an underlying gut dysfunction, you get that rectified. Things like nutrient absorption improves. So let's say if there's a B6 deficiency, which you often see with gut dysfunction, and I suppose the role of that as a cofactor in neurotransmitter metabolism, folate, B12, and the antioxidants too, to an extent, like even vitamin A and D would be important in, vitamin D obviously is, like that's well documented, things like seasonal affective disorder, but also vitamin D has a role in healing the gut as well. So I think if we're looking at from healing a person from a psychiatric perspective, especially someone as far gone down as suicidal ideation or indeed suicidal attempts, it's something that's really lacking, I think, in the field. Because they can't always, people say, oh, just eat healthy and exercise. It's not that simple for someone who suffers from depression or a strong suicidal ideation, especially actually someone who's had an attempt and has come back from it. If they got saved, they're usually pretty pissed off, to be honest. And then they're probably going to try it again. The problem is the next time they're probably going to do it better. And, it's just a psychiatric disorder. And the people with psychiatric disorders usually have a fairly high cognitive capacity. And they're usually smart enough not to tell people what they're going to do is, if they go to the psychiatrist to have their medication reviewed, they're probably not going to tell the psychiatrist that, they're having those thoughts. Because they don't want their attempts to be thwarted like they were the last. Things like that. So it's very complex field. But like I said, if you can get them stabilized the medication, get them, let's say, a little bit more positive, you could start working on the gut function, and ultimately they start to improve absorption of the nutrients, which are going to help them. Niacin being another one, it helps improve their health overall, not just the brain health. But then they start to see results as well a lot quicker. And some of the nutrient therapies, especially if you can do a nutrient profile and see where they really lack in, can be synergistic with the medication. Similarly, I suppose the other thing that's lacking in psychiatry is the blanket prescription of, let's say, SSRIs or SNRIs without any kind of understanding of the metabolism of each individual person's brain. So let's say if you're looking at genetic polymorphisms, people with, let's say, catecholaminergic transferase SNPs, they tend not to be the people that are going to respond well to SSRI, because you're looking at the brain as a yin-yang, serotonin, dopamine being intricately balanced for that individual. Like someone with a catecholaminergic transferase SNP, they take an SSRI and they tend to be a completely different person. They might go from someone being highly motivated, highly driven, to just being completely flat, no emotion whatsoever. And that doesn't, what you see is as a trend is they just tend to discontinue the medication. So the genetic component, I think, is a field that should really be incorporated into psychiatry, because you get a much better understanding on what treatments are going to be most appropriate, rather than what we do at the moment. We go to our DSM or ICD, we look at the list of symptoms, you tick the box, the patient has this, that symptom, let's say they have anhedonia, low energy, they're not able to get out of bed in the morning, things like that. The appetite affected, sleep affected, and obviously gross mood disturbances. And then we go to, okay, that fits in the box of depression. And we look at the severity of depression scale then, and I say, okay, well, step number 1 is SSRI, step number 2 is SSRI plus psychotherapy, or whatever it is. Usually first line is psychotherapy plus SSRI. But there's no real, I suppose, approach to, let's say, looking at the person as an individual. And of all of this fields of medicine, psychiatry is one where we really have to know the person. We do the personality, the behaviors, their traits, their exposures, environmental exposures.
Do you think, Fionnuala, do you think that's though down to education? Because what I'm talking about, we have a couple of GPs and doctors that would train in my facility, and it's I remember getting really angry when, you know, we were talking about health, and they were obviously talking mainly about medication. If we were talking about depression and the use of, you know, the medications you were speaking about. And then I was going, well, there's another way. I'm not saying that it's the only way, you know, we're looking at the functional medicine approach, but the fact that they were, and I thought at the time they were indoctrinated, but it's almost what I see in any industry is we will always teach what we know. And, you know, brought up around, and this is how you treat this, you know, like, yeah, based on you, like you're expanding your realm. So I'm sure based on your medical background, you would have a diagnosis, a way to diagnose and a way to treat that patient. But now you're starting to look based on your own, you know, trials and tribulations that didn't work and there has to be another way. And as you say, is there too much burden on the NHS? Is it coming down to education? You know, what's your thoughts?
Well, I suppose there's a few issues, there are a few things to consider there. So, you know, we need to have an acute service, you know, acute GP service. You know, like I spend a lot of time with the clients, that's really not logistical for a public health service. Or maybe it is, I'm sure maybe somebody could implement it eventually, but I suppose it's quite comprehensive and the time is not there. Like I said, they are on the NHS, the HSE, no different down here. And it's education too, you know. Like, you know, you spend 6 years in medical school, or 5 in my case, but and you know, you see that as the Bible, you know, that's your doctrine effectively, you know, and God, you spend so much time learning that it has to be right, you know. And the only way that I started to look outside the box was, well, I suppose I came from a quite scientific background, molecular stuff I would have loved. And so I would have known like glycolysis, Krebs cycle off by heart, and would have loved it. I would have keep digging deeper to find out more. And I suppose then when I had my own health issues and it really wasn't working, you know, it was a case of I was just sleeping tablet one day, something from my skin the next day, something from my bowel the next day. I just said, listen, like I have to go back to basics here. Like if I look at one cell in the body and look at the intricate pathway of glycolysis alone that occurs in every other cell of the body, then it really doesn't make sense to me from a scientific perspective that, you know, I can be, that the human organism composed of so many tissues, so many cells, so many little different pathways and interconnections and interplays is as simple as 1, 2, 3, 4, or symptom X, Y, Z fits the box for this label. I said that just doesn't sit with me, which is why, to be honest, towards the end of medicine, I wasn't particularly too keen on being there. I enjoyed, like, I didn't like the clinical stuff, I liked the science stuff. So then I found functional medicine. Obviously, it was like music to my ears. You know, I was sold. But there was something else I was going to say there, and I've lost it. Oh, but I suppose in terms of physicians and the current practice, you know, it's like I said, it's not that they're deliberately not looking outside the box. It's your way of thinking is different in that environment. You know, like you're taught to think that way.
Yeah.
And it's like a religion as such, you know, effectively it is a religion. And, you know, if you follow that Bible, and that gets people well, like, I mean, it does. And you do see people who take medication and they get well. Now, they might not be well in 3 months' time when there's side effects of the medication and they need to keep increasing the dose. And especially when it comes to psychiatry, I suppose, the other problem with the diagnostics is, you know, well, I mean, particularly relevant to psychiatry is the overlap there, you know. Like if you look at DSM or ICD, you know, people who tend to have end up with major psychiatric disorders or schizophrenia, major depressive disorder, you know, especially with suicidal ideation, that didn't just happen overnight. You know, it's not like some switch flicked in the brain and automatically they're thinking about going out and hanging themselves. It's not that simple. You know, it's something that's usually built up over the years, and probably the person that's gone in and out of different, you know, psychiatric illnesses, or OCD. So people would have compulsive tendencies, obsessions, you know, things like order, control, behaviors. So, you know, you're putting them into a box of depression or putting them into the box of schizophrenia or dissociative identity disorder. These are just like obscure terms that we use to make it easy for us to standardize things, and it works. Don't get me wrong. Like, I mean, you know, they usually have a major feature like addiction. You know, addiction is, in my opinion, anyways. I'm sure there's plenty that would agree with me. Is really the end stage of a long history of psychiatric illness, which has not been properly managed. Whether, you know, I mean, that's not necessarily down to the failing of the doctor. You know, the patient may not have even been aware of being in any psychiatric illness. But then once they touch a substance, and that's why hard drugs are addictive, is because they usually tend to work. You know, they usually tend to work for a period of time. And that's why they become addictive. So if the patient is left untreated or improperly managed, let's say, for years and years, and all of a sudden they find a drug that does what they've been looking for their whole life, then it's going to be very hard for them to go from thinking about suicide every day to feeling amazing on this drug, which makes them feel like everyone else in the world. So substance abuse, and particularly, I mean, addiction, is doing for people what the system really isn't. Because it's clearly not working. Like, I had a lady this morning, and what did she say? She wouldn't. Her parents were both addicts and alcoholics, actually. And I was asking her about her history. She'd been a smoker, you know. And usually when you see smoking in the history, it's unusual nowadays, you know. She was talking about drinking. She's the lady with the skin issues, actually. And she said, I was asking her about the alcohol side of things, and she was just commented, you know, like that she likes drink because of how it makes her feel.
Yeah, it's escapism.
You know, and that's your warning sign that there's a problem, you know. Like people who are not addicts, they can have a drink here or there. But she said specifically, I like the drink because of how it makes me feel. And that's where you end up with problems. And she would be the same kind of dopaminergic predominant brain.
Yeah. Just based obviously on your medical background, Doc, there was, again, I wouldn't know exactly, but I remember one of the podcasts I listened to Ben Coomber's podcast with Dr. Tom O'Brien, the head of the Gluten Summit. And regardless of obviously thoughts on gluten or anything, but he'd sort of, based on his background, he obviously had an issue with his grandmother. I don't know if you have listened to it before, but long story short, I'm not remembering. I think it's like number 72 or 73. I know you're probably too busy listening to stuff, but he sort of quoted, he says, on average, when, you know, the research of any sort of subject or whatever it is comes to the forefront, obviously the meta-analysis, it's agreed upon that this is, you know, the new treatment or the way that you treat whatever it is, the circumstance. On average, he said that it filters down to GPs over 19 years. It takes 19 years for that research to then start to filter down to general practitioners. What's your thoughts on that? I don't know if that's exactly.
Yeah, no, I would agree with you there. And like, that's why I suppose, like, I mean, you see it in like, even if you convert it to bodybuilding, you know, like things in training, like, okay, people figured out things how to grow muscle like years and years ago through practical application themselves. Okay, the research maybe came down 20 years down the line, but it's the same, like, you know, it's been fascinating for me the last few years. Absolutely incredible, because like the studies you see on the microbiome largely are with rats, you know, like animal models. But for me, it's incredible because, like I said, years and years ago, like 38 years at the stage, maybe longer. But, you know, I've been doing the stool testing and seeing it in actual people, you know, because how it works is the person comes, they tell me the symptoms, like, okay, I think they need a stool test. We see the finding it on the stool test. And like you said, at the time, the research wasn't there. But all I was doing was seeing the stool test. It was like, that shouldn't be there anyways, you know, and they don't have enough of this. So I was really just resetting that balance. And lo and behold, they come back a month later, like sooner sometimes, flying, like, you know, in terms of, not everyone's that quick, obviously.
Yeah.
But, you know, the symptomatic improvement, the actual real hard data. Okay, it's not hard data, but like, let's say the real, you know, in real life, not on a paper or a journal, is sitting in front of me, you know. The patients are coming back like clockwork.
Yeah.
You know, their energy's improved, their skin is improved, their mood is improved. They're dropping body fat where they may have been on 1,200 calories before and training every hour of the day. They do nothing but putting on weight, and everything just seems to be fitting into place. And like I said, I'm not, you know, I have no problem admitting that I didn't really know why is this happening, you know. But, you know, kept working, and then all of a sudden over the last few years, all of the research is coming up that in animal studies that's consistent with the clinical stuff that I'm seeing with humans.
Yeah.
So I would agree that probably things take a while to filter down, but that's another problem with the conventional side. It's very, like, I mean, of course the model is good, you know, everything has to be research based, and certainly when you're dealing with pharmaceuticals, of course. but it just takes a long time to filter down to the patient. You know, it's more important that it's filtering down to the patient than to the GP. You know,
Yeah.
so patients are not getting the treatment soon enough, and that's why functional medicine, I love it anyways. You know, and the thing my patients do, I hope to do, is because there's a certain there is some clinical acumen that comes in besides just a research paper. You know, your experience dealing with people. Like I think you learn more from that than you do from any research papers.
That's
Actual interactions with people.
That's like amazing in terms of, you know, if I relate this back to sort of fitness, and, you know, obviously I'm in the education sector and educating new personal trainers, and it's a case of what's going to happen is a lot of them leave with this say confidence, but they're always going to look at their peers and thinking that they're judging. We were just talking about it with students, and what I said was, what will happen is you'll have your mentors and you'll follow them, and you'll believe their word is truth, and then you'll find new mentors, and then until you get enough practice of people in front of you for you to forge your own opinion. As you say, sometimes the research is behind, but it's you know, Dr. Fionnuala McHale has told me this, but I'm seeing something different.
Yeah, exactly. Like, for example, obviously, like, I've been close with Dr. Eric Serrano over the last few weeks, and like, you know, like you learn from people. You learn from people who've been in practice, you know. Like I said, it's all well and good, like, reading a study. And remember, studies are, like, evidence-based studies are, you know, 40% of the population did well on this. Like, and often you'll see, especially with drug companies, they pluck the data they want. They don't tell you that 40% of placebo also did pretty well, like, you know. So like you're right in the sense of, let's say, you can follow a person. So, like, you know, in PT, I suppose people would follow, example, Charles Poliquin, you know, people, and anything he says is gold. You know? But over the course,
three Ferraris later.
I mean, don't get me wrong. I think Charles is great, and he's taught me a lot, of course. But you learn from different people, and the people to learn from, well, my experience, anyways, are people who've been in practice and dealing with actual people. Like, even if you look at from a body composition point of view, you know, trying to get people to lose fat. Like, most people who've worked, like, with a variety of clients over a number of years will be able to decipher whether the person needs to, like, it's like prep. Okay, the prep is the best one. You can see from looking at a person, you can see from their tissue density, you can see, you know, the shape of their body, you can tell how well they train, and you can probably tell, I think that person would do better on carbs, or maybe they need to pull the carbs, or maybe they need to change salt, or, you know, or maybe they do better on higher fat, maybe less protein, veg. Like, these are things you can see, like, you know, and that's, I suppose, things that you would do apply to medicine as well, to an extent, you know.
Yeah. What I love, again, like we were saying again earlier, I know I'm probably propping you up, is your ability. And Perry Nicholson, just on the previous podcast, was the exact same. It's just like, you know, you might not agree with everyone that you speak to, different practitioners, but if you can take something away from it, maybe it's more open-mindedness. No, I know we mentioned Charles Poliquin. Now, I know Charles is very, what I would call, probably say he's very vast in his approach, because he believes his approach is really the only approach. I haven't really seen any stuff, whereas, you know, you look at the likes of yourself, who's applying maybe stuff that you're learning from Eric Serrano, from obviously Charles, and then your, you know, background, and applying that again to the person, the individual, as opposed to,
yes,
you know,
and that's the thing. There is no one-size-fits-all approach. You know, whether that's medicine or whether that's training in the gym, there really isn't. And even, like I say, for one person, there is no one-size-fits-all approach. So people are looking for the perfect diet. You know, there is no perfect diet. You know, there's no blanket perfect diet. There's no perfect diet for one person for their whole life. You know, people cycle in between different needs, you know, in terms to make progress with performance. You know, the body's an adaptive organism. So if you're low carb for a while, and you lose some weight, you're not going to be able to maintain that. You know, if you're high carb for a while, you won't be able to maintain that. You have to cycle. It's no different to a training program. You know, people change the training program because the body adapts. You can't keep doing the same training program, or you'll never progress. You won't get any benefit from it, because the body adapts, so that becomes the normal baseline. So, you know, you're not going to even derive much benefit from it. So that's the incredible thing about the human body. It is adaptive, you know, and it's like, you know, it has an incredible ability to heal itself.
Yeah.
And I think that's the most incredible thing in life, actually.
See, what you're saying is
You're trying to trick that system sometimes.
just to go back on the point, remember we were saying about people not stepping out of their field, or even just that bias. What I noticed from our advanced nutrition course, and even when I've mentored people in terms of nutrition, you know, in a bit of extra work, we'll have some case studies. And what I found was, you know, I would take a small group, maybe about 5 people, and I would give them all the same case studies. And the amazing thing is how different, like for the same person, the approach is. You know, you do have someone who has different calories, macronutrient breakdown. You do have someone who's maybe married to, you know, a ketogenic style diet, low carb. You have someone who promotes intermittent fasting, and then we get together and we have a sort of round table discussion. And it's like, what I want you to understand is obviously the core principles of weight loss and whatever you're trying to achieve, but not to buy into that bias. As you say, everyone is individual. If you believe, you know, you see it with a lot of newbie trainers who maybe have, you know, done a transformation and they got their results on a low carb diet, and then the next thing they do, they're handing every client.
Everyone is on the low carb, like.
Yeah, and it's
yeah, but even when you come to like that applies to medicine as well, in the sense of like, you know, like, okay, I could sit here and say, oh yeah, depression is caused from the gut dysfunction, or it's caused from inflammation, or it's caused from like childhood abuse, it's caused from HPA hyperarousal. The pathogen, let's say the etiology of that disease could be absolutely different from one person to another, which is why disease labels won't work. In the same way, someone becoming obese could be whole factors that were involved. Could just they ate too much food and they moved too less. It could be that there's that compounded with, let's say, gut dysfunction, compounded with stress. Or it could be either of those in isolation. So, you know, they're like that. That's I suppose where the future really, I think, lies in healthcare. I mean, fitness and exercise is part of that model of healthcare. You know, I suppose we've been talking kind of in isolation this hour, but you know that's an integral part to health. I mean, there's no doubt about that. I'm the first one to say that. And even in that as a therapeutic strategy, there becomes a point where that can be pathogenic, you know, in terms of psychology, you know. And I suppose I tend to see a lot of it now is, you know, people get into fitness. It tends to also be people who have, you know, they maybe partied a bit too much. They tend to have addictive tendencies. They get into fitness and they're intense about the fitness then, you know, and it starts off as something that's a bit fun. But the same person, you know, that's very classic. It tends to be something I see quite a lot, you know. The person who goes, they may have given up drugs and drink for a while, you know, and then they get into the gym and they're obsessed with health, eating and training, and they become high intensity at it. And like I said, fun at the start, but then what happens is they progress onto, let's say, wanting to do a show. They want to do a bodybuilding show. And then they become into the dieting side of things and they get very rigid. You know, they love the numbers, they love the control, they love the results, and that becomes addictive. And I suppose, you know, that doesn't end well either, because they're not getting any health benefit. In fact, it's probably detrimental to the health, you know.
100%.
So it's you know, geez, everything is a positive and negative these days. Like I said, even if bloody cheat meal probably has some benefit. It does have some benefit, but like, you know, when people ask for the perfect diet, I said, you know, or no, the what healthy, what's healthy? Yeah. So well, healthy pertains to the individual themselves. So like for some person, having a McDonald's might actually be healthy for that person, you know. Let's say someone with an eating disorder, maybe the psychological aspect of them having the McDonald's far outweighs whatever nutritional values in it at all. So what's healthy for you, if healthy is, there is no global term. I think the only thing that we can say in terms of nutrition that's, I suppose, recommended is, or that's backed up in the research as something that we need to have in the diet is meats, or is vegetables. Thinking of myself, meat, but it's vegetables, you know, the benefit of vegetables, herbs, spices. Short of that, you know, they say high protein is good, low protein is good, then high protein bad the next day, high fat is good. You know, there is no such thing. If you keep veg in there, I think you're doing well. I'm not a vegan, by the way.
I think I see that quote. What all health practitioners can agree on is like,
pardon?
I've seen a quote from me, and it was just like, and again, it's like all health professionals do agree that you do need to eat more veg. I think that's a given across the sort of order. But just to take it back,
but then somebody can end up eating too much veg too. Like, you know,
too much of a high fiber diet. What I found interesting was I was down at the ISI Malahide recently when I think it was actually this time last year. Yeah, whenever they had Mick Mutzer over.
Oh, okay.
Zymogen. Now,
yeah, he's great.
Mick was just talking about gut health and stuff like that there, and it just, not that I went off the board of it, but it just reinvigorated my love for that sort of stuff. And he mentioned one thing, and it ties back with what you said earlier. It was, you know, I asked him a question. I was like, Mick, my job is body composition. That's what clients are coming to me for. You know, as you said earlier, you have a client who, like, technically should be losing weight. They're on 1,200 calories. They're training, you know, maybe 7 times a week or multiple training sessions. Why is this not working? And there was one thing they mentioned, and it, for me, again, he says it's only early research, but it just clicked home from seeing a lot of people, was, and I was like, these guys have stubborn fat areas, they're not able to lose. You know, have you any idea or, you know, any implications of what's sort of going on? And what he had said sort of correlates with what you say, where there is massive inflammation, and the fat, that stubborn fat, is actually acting as a protective tissue.
It secretes the inflammatory signals, you know. Like the more, like I don't know what it was, maybe last week I was reading about it, but I suppose remember, like, adipose tissue is effectively an organ. It secretes, you know. So there was a link actually between, you know, the more obesity and depression and inflammation. I think I put the slides up last week actually on Instagram, but the link between obesity and inflammation and depression. So let's say the fat tissue there is constantly secreting cytokines, and I mean, the more fat you have, technically the more inflammation you have, and ultimately again the more neuroinflammation you're going to have too, and the impact on mood. But certainly on the metabolism side of things, you know, being able to trigger a change, and that could be even an anti-inflammatory diet, you know. So you see people that they have the what's it called, if it fits your macros, you know, like that will work okay if someone just has a simple case of energy input versus output, I guess. But I wouldn't say it's necessarily a healthy approach if you're trying to target inflammation. Again, that comes back to the same thing. What's the cause of the inability to lose body fat? You know, is it that they're eating too much food? In which case, as simple as reduce the food and increase the output, or is there something else more sinister out there?
That's we're based off that sort of what we were talking about. My approach is not that it changed, because it was just like, I think now in terms of my own, I have a more implemented system. So it's a case of, you know, I haven't got the resources you have in terms of, you know, being able to test stools or never. So,
and thyroid as well, obviously.
Yeah. And I will go with a simple, you know, calories in, calories out model, movement, nutrition. And then once I get to that point, it may be something that I look at. Now, I will have a massive proponent of, you know, omega-3s. I love turmeric. I try and have as much of an anti-inflammatory diet as possible. But then when it gets to a certain point, I'll start looking at really into food quality and potentially what's going on there and trying to clean that up. Like, just on that, what's your thoughts on, you know, sensitivities, allergens, intolerances?
Yeah. So I suppose, like, lately, again, like with the benefit of, you know, clinical practice, I suppose I tend to not use too much food intolerance testing unless I've done a stool test first. And the reason being, if you have any immune dysfunction by virtue of an altered microbial diversity, let's say, then you're going to test positive to a whole pile of foods that don't mean, that doesn't necessarily mean that you can never have those foods, you know. Yeah. It's like, again, gluten containing foods are going to be inflammatory, so they're not doing you any benefit health wise anyways, you know. You know, dairy causes a huge amount of problems. It's polluted with toxins, and so, you know, cutting those out is not going to do anyone any harm. Like, it's going to be benefit, but it's not that I rarely see a case where there's really an inflammatory response to otherwise normal foods, unless it's obviously celiac and it's a genuine allergy type thing. But, you know, intolerances and such, where you don't have underlying gut dysfunction itself, and changes in the immune system, that barrier again that I alluded to earlier, being dysfunctional at that level. And obviously, if you know, it's like air traffic control, someone put it as before, but you know, it doesn't know where to send the planes. You know, the connection is lost, let's say. So that barrier is there. Like, okay, I don't know what's toxin, I don't know what's foreign, I don't know what I want to take in. Is this a vitamin? Is it a mineral? I'm not sure. So hey, let's just take some stuff in and see what happens. So, you know, you tend to, again, you get the lipopolysaccharide permeates the barrier, endotoxemia, but also, I suppose, food toxins. Then, you know, it's just your response, your inflammatory response. Because again, it's the body's a bit trying to defend itself, because there's so much damage there to the lining. So what I would generally do is try to get a stool test first. Again, if there is altered microbial balance in that instance, you're going to be putting them on an elimination style diet anyways, you know. So the trigger foods will tend to be out for that period. And again, that really allows, it's not that they can never have those foods again that are not on the elimination style plan, let's say. It's more a case that gives a nice anti-inflammatory balance, you know, in keeping with, I suppose, the research that shows low, on the high fat, the high fructose diets are not obviously conducive to good health. Low fiber diets, again, are going to cause problems. And high caloric load. I mean, if you look at the benefits of, you know, calorie restriction and I suppose appropriate calorie content in gut health and microbial diversity for sure. But so to go back, you address the microbial diversity, and then, you know, ultimately once you've kind of, like, let's say there's a blastocystis there or diatomega, you get rid of that. You repopulate whatever is lacking. So again, you're looking at the Bacteroides, Firmicutes, ratio and things. And then ultimately people tend to be able to be able to consume foods. Now, again, a lot of those foods don't have a huge amount of health benefit anyways, but they're not going to be in distress for the next 3 days after they go out for dinner if there's a tiny bit of gluten or something in the food, or a bit of soy, you know. They are with the menu, you know. They go, I see the people, you know, they get the food intolerance test and they go out to the restaurant and they're bringing the sheet in with them to the restaurant and make sure there's none of this is, and in most cases it tends to be very healthy foods. Like they might test up for things like broccoli and stuff, you know. She's at me again.
I love when they come back with, you know, I'm allergic to, you know, goji berries. Okay.
Oh yeah.
You eat goji berries? No. Well then, what the fuck? You know, like,
so what you usually find is that people with parasites is they tend to bloat even on a glass of water, you know.
Yeah.
So they be bloated all day long, you know. Even just with water, like anything they put in, it's going to bloat them, you know. And they try to stop this food, that food, X, Y, Z food, and they're bloated regardless, you know. Or they're uncomfortable, or they go to the toilet multiple times a day, they're constipated, or whatever it is. And the skin is reacting to everything. So the skin is always, like, it always gives us a good, let's say, it's the ultimate semaphore. So it gives us a good window into what's going on underneath, you know. And again, you have to look at the gut and the hormonal impacts too, you know, with beta-glucuronidase and estrogen metabolism. So there's a whole pad there.
Yeah.
The gut is, you know,
like you said, with even just people with impaired gut microbiome, and the fact of, you know, them just getting bloated. This is where I love the debate. I hear a lot of, you know, what do you think about intermittent fasting? And a lot of the time, anybody with IBS or IBDs or any of these conditions, and it's like, yeah, I feel amazing on, and next minute it's the best thing in the world, when realistically they're not either digesting that food or whatever's upsetting their stomach. And so next minute it's, oh my God, I love this thing. It's the best thing in the world. And so I just wanted to bring that up. I'm sure you experienced that.
Yeah, but you see, that's the thing too. So, you know, like people say, oh, intermittent fasting worked for me. It sorted out my bloating. Okay, and maybe it does. Probably like largely to do with the lower caloric load. Yeah. And obviously the benefits maybe of, you know, how it's the fasting period is altering hormones, you know, things like ghrelin and stuff. But inevitably it's going to catch up with them again if they have any underlying dysfunction, you know. It's probably just keeping it at bay for a period of time, which is why you see people like go on elimination diet for a while and they do well, which, you know, you would expect, but they bring in the foods again and they're back to square one because they haven't identified what organisms are causing the problem, you know. Like whether it's, you know, candida or other fungal species, or it might be a bacterial issue. Parasites are so common nowadays, you know.
So, like, just to bring it back on, because I know we were talking about treatment for this sort of stuff, and we were talking about, like, you were just saying about re-inoculating and, you know, probably fixing that imbalance. Is that the first thing you would go to? Like, obviously based maybe off a stool test, would you be going, right, I want to readdress the floral balance before you do an elimination diet, or do you want to do your elimination diet and then?
Oh, well, I do them you do them together. So, like, say for example, let's say someone tests positive for, like, okay, let's say the blastocystis on the diatomeba. You might usually have to give them the pharmaceuticals, you know. Then I usually go with the cleanse, you know, like a medical food time. Medical food, again, is helping to promote a healing environment for the individual, and tends to help. And you're obviously, you've kind of taken, I wouldn't do eliminations, I want to do on medication often, because they tend to be heavy medication that can make people feel almost like they have a flu, so it tends to be too much at that time. But then you're looking at, I suppose, I use herbs, like berberine, grapeseed extract, uva ursi often I'd use, plantains, and they all tend to work quite well synergistically with the medication. I usually use both. Usually run the berberine for a longer period of time, just to make sure. And again, that will have an impact on blood sugar stabilization too.
Yeah, so you're using the berberine essentially for managing.
Can you hear me?
Yeah. So you're using berberine for fat loss and managing blood sugar level.
Well, largely as an antimicrobial, but it tends to work well for blood sugar stabilization too. It's a while now since I had a look at that research, so I'll have to look at it again. But definitely the antimicrobial effect works quite well. But again, like, I wouldn't use it in isolation. Like, I'm very, like, again, if anyone has any suggestions, I'd be open to listen to them. And I suppose that's the nature of the job, to be able to listen to other people and their inputs too. I'm not the gold standard expert, I learn from everyone, and especially from Dr. Serrano at the moment. They're learning a huge pile. But I suppose you learn from practice, and I suppose from my perspective, I've been kind of on my own for many years, so I sort of had no choice but to be going through the research, figure out, well, what the hell do I do this time, because every patient is different. So to go back to the question, I suppose, using some herbs alongside re-inoculating or whatever it is that they need, and I suppose that's important too, because you see, like, people, they take probiotics, especially in cases of IBS, and sometimes it can make them worse, especially if they're taking a prebiotic. I like to use some of the rhabdoblactins and things like that alongside the probiotic, because it helps to keep them there. It's like food for the good bacteria, effectively. And prebiotic foods, things I would use as well would be ghee butter, obviously apple cider vinegar and things like that. And I usually like people just to have a good gap before they go to bed from let's say last meal until sleep. Again, it's the same principle as just keeping the gut empty. So you're given enough time for, let's say, the stages of sleep to ensue in terms of recovery, repair, detoxification, and all that. And then in recovery is the last stage of sleep, obviously. But, if you have a belly full of food and you're going to sleep, obviously, there's going to be a huge amount of time spent churning that away before, you can get to the sleep process. My little one's here snoring on top of me. You're getting plenty of sleep, I'll tell you that much.
So,
it's just much like going for walks.
We've obviously spoke a lot about the gut and the issues in terms of what we see, but going on to the other side, is this what led you into the sort of IV nutrition side? You maybe working with a lot of athletes who you had maybe.
Yeah, I tell you how I got into the IVs actually was it was true. I was working with ISI, and they kind of were asking me about getting it for the fighters, so Connor and all of them. So because obviously everyone else was using it at the time in the UFC, and other athletes for years, obviously Ireland behind everyone else. So I said, here, let's have a look into it, so I went off and did the course, went to training in it, and I suppose that was the start of it for me, really. And then, I'll be honest, when I first started doing it from other people, I'd never done it myself, on myself, let's say, or I'd never had anyone administer to me. So I kind of was a little bit, I was kind of cynical about it, no, you just inject the vitamins, can you not just take these orally? And obviously I know, with the gut, if someone's not absorbing them, great, but I didn't think it was going to be as dramatic as it was. When I had my own first one, it was incredible, I was this is good, it was so
that was
and the thing is, I did it for the fighters. They were just before a big fight. I think it was Boston at the time. But I remember a few of them texting me that day, when can I get another one? I guess, I better try this now myself. This is great, They're like, oh yeah, I definitely need another one of those. It's Jesus, I wonder, is it just placebo effect?
That's why. Yeah.
That's why I got good at the IVs as well, I suppose, was because, again, using them on myself as an experimental model, if nothing else, and also working with athletes. And athletes are fantastic for giving you feedback. So because they will notice, oh, I think I slept a little bit better, or even if it's a bodybuilders in particular, are brilliant to work with for IVs because they're great models in terms of giving you feedback, because they're hypersensitive to everything that changes. You know, you'll notice, like some people will say with I think certain ingredients will have different effects. So let's say someone I was a lot calmer after training. Someone else notice, oh, I got a huge buzz from, you know, before I went to training, especially when I had a coffee, or, you know, the pump. You get great pump after you have it, especially if you do the bodybuilding workout, and performance improve. Like that's why a lot of people will get it before. You know, I've had a few powerlifters and things like that do it before competition, or especially marathon athletes. You know, long distance runners and things like that, because it does, I suppose, enhance the, if not even if it's nothing to do with, let's say, the underlying physiology, biochemistry, and metabolism and that aspect, but and substrate utilization and things like that are obviously likely to be enhanced by, you know, replacing nutrients that might be deficient. But the motivation and in the head, you know, how it's affecting the brain transmitters, you know, the desire to want. Because if you look at depression, and perhaps maybe it's addressing an underlying nutritional deficiency, and that person is maybe low-grade depression, you don't know. But if you look at depression, you know, one of the features is, you know, it's not like they don't have the physical energy to exercise, but emotionally they just cannot get out of bed. It's not like they're not, their muscles are not able to do it, you know, but it's the emotional energy, the mental energy, so I always talk to people about, and that's improved significantly from the IV. You know, I suppose it's pyridoxine and the IV things, and how that's going to affect the biochemistry, niacin as well, thiamine. So all of the B vitamins there having a major impact, and obviously glutathione having a huge impact. Because anyone who might have the GST snips or things like that, can be very beneficial. Things like libido improve. You know, I had a few good reports back on that. I remember one time I did it for a girl, like, and her husband sent me a message back, when can I book her in for another one? Like, oh, that's good.
Brilliant.
So,
that's obviously why I brought in the IV. It's a case of, you know, you're bypassing the gut straight into the bloodstream, maybe dealing with whatever it is, that maybe nutrient deficiency, and then they're experiencing, as you say, the athletes are able to tell you, the bodybuilders are able to tell you, you know, my skin's getting a fever.
Body composition as well, like the vitamin C again. So by again, using clinical experience rather than, like, I mean, you'll see studies maybe on like individual nutrients IV, but from clinical experience of having the person come in and tell me like why they want it in the first place, what type of symptoms they report, and giving them an
Hello? Yeah. Sorry guys, bear with us.
infusion. So the infusion is not like the bag, it's not standardized, and then seeing their feedback afterwards. So seeing how they're responding to the nutrient doses, you know, like, it was sleep improved, there was anxiety improved, and then being able to subsequently tweak the dose thereafter, you know, to maybe they need more of one nutrient or less of another. And then when you look at a bodybuilding, obviously for prep, it's fantastic. So they're depleted anyways. And again, athletes do weight cuts, tweaking the nutrients, but then the vitamin C is great for the prep week, you know, to dry them out, and also it's nice before the carb up because it makes them highly insulin sensitive. You know, so they carb up, and it's just it looks like physique wise, it's just beautiful to see it, like, and again, like I said, it's great in the body, especially prep, because it's so lean, because you can see it visually, like, you know, it's very obvious, like.
Yeah,
and those things are like, I think those things are much better than any research paper you're going to read, you know, when you see it in human being and it's objective. I mean, visually you can see things happening, you know, you'll see it after the vitamin C, the veins start to pop, vasodilation is great, perfusion, like pump. So I suppose that's the way I would work the IVs, is really tweaking the doses.
You think that's obviously during prep they are going to have nutrient deficiencies, but do you see a correlation with, you know, a lot of bodybuilders and physique competitors obviously having impaired gut health? You know, whether it's so you see, I think what I see a lot of, you know, I was talking to, go ahead. No, just like whether it's, you know, the medications they're taking or whatever it is, but do you see, like, you know, an impaired gut health in a lot of those sort of types of people?
Yeah, you tend to see it more so after comp. So, like, you know, after, let's say they've been calorie restricted for a while, and then they go to the bulk phase, you know, and the volume of food is so high, or let's say post-comp binging, like it's like you said, the changes in microbial diversity happen very fast through tweaks with diet alone. So, you know, post-comp binging is a recipe for disaster for the gut health, if nothing else, you know.
Tons of
And
shit.
again, they said to be the same people that blow up, okay, regardless of what extra supplements they're taking, like Clen or T3 or things like that. Like that's compounded by, again, probably the person who gave them those drugs probably didn't talk to them about tapering off and how to manage the come down off them as well. That's important too. And but also I suppose that the huge caloric load that tends to go whack in after a period of calorie depletion, you know, even if they just resume calories to baseline afterwards, it's going to have an impact on the microbial diversity, the lining of the intestine, impaired intestinal permeability, but inflammation, you know, and the impact on the metabolism by virtue of that, you know. They often end up very nutrient depleted because even though they're taking in a higher volume of food, that they've damaged the lining to an extent whereby, let's say, they might not be absorbing a lot of the vitamins and minerals, and taking in too much toxin, and it tends to be junk food as well.
Yeah.
So it is a recipe. It's like it'd be so great if somebody could, you know, I suppose bodybuilding and the nature of the sport is obviously there's a huge amount of drugs involved, and it tends to be black market drugs. And again, I tend to get the people that come after they've had the show and they're pretty messed up. So you know, I see a lot of it on test, and they think they're taking one thing and they're taking something else. So it'd be great that say somebody was, you know, more wide. There's more wide. You know, I think there should be a far more widespread education, particularly the medical professional, around the use of steroids in bodybuilding. Because I've ended up getting a huge amount of clients, and they tell me that the endocrinologist won't work with them because they've used steroids for bodybuilding. You know, I really think ethically that's a problem. It's just like saying you're not working with a drug addict because they ended up using heroin. I mean, that's not ethical, and from my perspective, especially from an endocrinologist who theoretically is more of an expert than I'll ever be in endocrine. You know, I try to help them as best I can because I really disagree with that approach. But you know, there needs to be a lot of work around that, and even from a personal trainer perspective. Okay, say if they know the client is taking something, but you're right. It's probably worth it in the nature of the podcast today to highlight that issue with the gut side of things, because that's one thing that we can look at. There are clean athletes out there too, and you know, the best intentions of the world. You know, I've done it myself. You finish the show, or you finish, like, even in powerlifting, we do weight cuts, you know, and you've been losing weight. Especially, it's probably worse in powerlifting than it is in bodybuilding, because you do usually a sharp weight cut. You don't diet for weeks, and then, you know, oh, I better lose a few kilos for the weigh-in, and then you can't help but binge up on food afterwards, you know, and you're horsing it into you as well. And anyone with addictive tendencies will eat very mindlessly. So, you know, it also almost becomes an addiction in that instance. You know, they can't stop eating the food. You know, the satiety signals are off. And again, a recipe for disaster all around. Because again, the serotonin metabolism is going to be off in someone dieting for that long as well. You know, the stress hormones are elevated from low body composition, so the availability of tryptophan and things like that will be impaired. So the sugar cravings will be so high. You know, obviously the role of serotonin with sugar cravings, and then like that addictive nature of the sugar, they'd be constant. It's like, say you have someone dieting for a show, and they're always eating clean food. That's why I disagree largely with, like, cheat meals in the sense of junk food. So let's say someone decides to have donuts or whatever else. I mean, especially even from my own experience, it's easier to eat plain bland food all the time than it is to have one day where you can binge up on donuts or pizza or everything and get all the flavors and all of that pleasures signals in the dopamine in the brain, and then have to start all over again. It's like being an addiction and relapsing every time. You know, and you have to go through the period of cravings then all over again. You know? So I think it's better, let's say, if they're having a cheat meal, it's really a refeed. So there might be a little bit of extra rice or oats or things like that, because it's like even protein bars, they're a nightmare, because they're even worse because you're getting the sweet taste, but you're not actually getting the sugar load. So it's almost like a false hit. You know, it's like you're getting close to your fix, but you never actually get it. So, you're looking for sweet stuff for the rest of the day, artificial sweetness as well. You know, I say it's better to keep the simple, whole, bland food, especially for prep, because that's why they're dieting. you know, than it is to have little. It's like it's almost teasing you, you know, little hits of sugar. Like, oh, I just got it, you know, and then you're off. It's too hard to get back on track. Then, you know, when people find that, and actually, I think that applies very well to general public, because, you know, like they have less motivation to get back on track after the relapse. I say usually cheat meals are like a relapse, you know, of, let's say someone is in drug addiction, because you're just sparking off the addictive nature again for that drug of choice, i.e. sugar. Like, I mean, I'm not saying sugar is a drug, but how it affects the brain is similar to drugs.
Yeah.
You know?
We see it as well, like whenever we're obviously owning a gym and facility and stuff as well, and there's transformations, and, you know, we get our guys in before they finish. We talk about, you know, the effect of metabolic adaptation and reverse diets and stuff like that there, and we give them the blueprint. This is what we need you to do, you know, post 12 weeks, 16 weeks, whatever they're doing. And 9 times out of 10, they're just like, fuck this, I'm going to eat whatever I want. And away they go, and it's just like, no, because I actually questioned my own stuff before. When I was doing seminars, it was a case of, do body transformations work, and do they work long term? And I actually questioned my own work. I'm just like, you know, they can, but it's very, very few and far between. And, you know, it is that addictive nature, I think, of people. They see it as, you know, depleting, and then once they get a taste for it, you know, that's why I'm not a fan of those sort of cheap meals, as you say. And not based around
like a refeed, sure, but not the cheap meal, you know. And actually, like, satiety from like a refeed on the foods that they're normally eating is usually better.
Yeah.
Especially, like, you can, but also I suppose you can find things that people, you know, things that work well actually are dark chocolate. And I think it's less to do about the macronutrient composition of the chocolate than it is to do with the fact that the flavor and how that's, you know, again, like, the signals to the brain come from the tongue. So it's not as intense sweetness that you get from, let's say, and actually I was thinking this the other day, you know, like the sweetness that you get from a protein bar is probably 10 times higher than it is from, you know, even normal sugar. Like, normal sugar doesn't taste that sweet. So the signal going to the brain and the pleasure reward that you're getting it from a dopaminergic perspective is actually much higher with the protein bar or artificial sweeteners than it would be with normal sugar. And at least with the normal sugar, it's like I said, you have a choice often, you know. If you have a Galaxy bar, one of my favorites, or you can have a protein bar. Okay, so I said they're probably about the same calories. Okay, the other one might say it's low carb, has all these sugar alcohols in it. But my Galaxy bar has probably got actual sugar in it, you know, probably normal sugar. It won't have the protein, but sure, I probably eat enough protein anyways during the day. And at least the sugar I'm getting from the Galaxy can actually go to my muscles and do something, you know. It can actually fuel my activity for the rest of the day, fuel my brain. Whereas the rubbish in the protein bar, it cannot do anything metabolically. You know, I'd even question whether the protein is of much use.
Yeah, it's always a blend.
And you're just causing yourself so much trauma emotionally by getting that little sweet hit and then having to go back to the bland food, you know.
Yeah. People are going to hit
then people end up having to have a coffee because they need to take the edge off the appetite, and it's just a vicious cycle, you know. But again, it comes down to educating the client, and to be honest, most people figure it out fairly fast. It depends on their level of motivation to want to achieve the transformation. Like I said, bodybuilders can usually get away with it because they have a high level of, you know, like they want to do the show, or they're competing in a week or two, so they know it's going to reflect on the stage. But general public, it's a lot harder because, you know, they might not have a date and as such. And in that instance, I always say things like, you know, chocolate rice cakes, or like dark chocolate. They're more bland in flavor. They don't tend to ignite the same pleasure pathways. And again, you're looking at the impact of that on, you know, people with the, you know, addictive tendencies as well. It's going to be more significant than someone else who's not genetically susceptible to that. And it comes back to behavior as well. So.
Awesome, Doc. So I'll wrap it up there. I've probably stole a lot of there. Thank you very much.
You're right, okay, it's my pleasure.
For me, I'm a geek on this shit, and I would happily listen to yourself or Alex Serrano. I'm sure John...
is he listening there, is he?
Well, no, I haven't seen him on, unfortunately.
Oh, okay.
We'll send him this podcast after, and we'll get him to critique it. But appreciate it.
I'm sure he'll have plenty.
I hope, again, that wasn't over too many people's heads. You know, just basically talking about different health aspects. It's not always about calories in, calories out. I love Doc's approach on not only his experience in terms of the physique, the powerlifting, and obviously come from a medical background and functional medicine background, something I'm very interested in. So, I may actually come down and try and shadow you at some point.
Dude, actually, you're more than welcome to.
Yep, I really just.
You'll have to put up with this little baby.
Yes, I just want to see the dog. Can I take the dog? What was that to say? But I appreciate your time. And guys, if you got value from this and you enjoyed this, obviously please share it on. And again, just give us a ratings on iTunes and just try and get us up there. Our job is to try and bring you some relevant information and try and make it in an easy, fun way that you can sort of embrace with. And we like to curse and swear as well, so we don't apologize for any of that.
No harm there, like.
So I'm just going to knock this off.
Okay guys, so thanks for watching today, and just one more thing before we go. If you got value from what you just listened to and you get value from the show, then simply pay it forward by sharing. Thank you very much.
Yeah.